So Catherine Feeney's one of our specialist nurses who also has a major role in research, and Catherine is going to come and give us a talk. I'll just say that it was supposed to be a double act between Catherine and Victoria Nesbitt, who's one of our junior doctors, but unfortunately Victoria's poorly, so over to you, Catherine.
So Professor Turner was asking me to talk specifically about research. I'm going to answer at the top of these mics. I'm very sure. Sorry. You shout if you can't hear. Let me know.
What about the
Right. Okay. So yeah, I'm asked specifically to talk about research, and you hear that a lot tonight. And I think really what I wanted to do was go back and say, well, what is research? Research asks a question. That's the purpose of it. So I'll just show this slide, and it's actually a leech, for those of you that can't recognise it. And I just thought it just demonstrates the point of how far back research started. Leeches were found to have a property within their saliva that helped with stopping blood clots. So leeches were used a long time ago. Milk. Pasteurisation. I'm sure that a lot of you will have heard of Louis Pasteur. It was critical in looking at how milk goes sour and how meat rots, and it was all to do with bacteria. And he found that by heating milk to high temperatures under pressure, it stopped the growth of bacteria and prevented the souring of milk. And this was all research. We maybe never recognised it as that, but that's what it was. Whether you recognise this flower as a foxglove, whether you've heard that foxglove actually has a property called digitalis, and that's used, it's still used today in heart treatments. Digoxin is given because it was found to be a stimulant for the heart. So that was discovered by a botanist who was British, a lot of British scientists. A very famous discovery. I couldn't find a better slide than that, I suppose. I should have found something better. I wanted to find some mould, but I couldn't. So I got the tablets in. Everybody recognises medication, and probably you've all heard of Alexander Fleming, who in the 1900s found penicillin. Obviously that was key to change medicine, and we were able to treat our soldiers in World War II against diseases that would have previously died from. So why do we do research? It's quite a distressing photograph. And this is actually a child who's got smallpox. So something that has actually been eradicated because of research. Research saves lives. Research improves our life expectancy and makes us live longer. So the scientist Jenner in the 1700s actually experimented with a child, and he scratched his skin with a needle that he'd infected with some smallpox pus. And he then waited and then exposed the child to smallpox and found that he didn't actually pick up the disease. And that was because he'd vaccinated him, and that was the first vaccination. So because of research, smallpox was eradicated and it saved lives. You're probably thinking, what you got a slide of Queen Victoria up there for? Well, somebody recognised it today. I was having a practice of this, and I was really pleased to see that one of my colleagues, the specialist nurse Angela, who's somewhere here, knew exactly what I was going to say here, because Queen Victoria was one of the research samples who she had some chloroform when she was given birth to her child. That made her childbirth less painful. It's changed the way that we get care in our healthcare facilities, including dentistry. Ether was used during tooth extractions, and obviously everyone hates going to the dentist. And obviously things have changed now. They do a lot more things in the dentist, and everybody wants to go now and have a nicer smile. So it's because of research that we've improved practices, and people now actually want to go to the dentist. So scientists and clinicians are continually asking questions. That's what research is. We continually ask questions to improve medicine. That improves our diagnosis and it improves our treatment care. So who's involved in our team and our research? It's a huge team, and I'm sure that most of you have met the clinicians that are involved, Professor Turnbull, Dr McFarlane, Dr Gorman, but there's actually a lot more to the team. Myself as a research nurse, and Lucy Cook's our new research nurse in paediatrics. We've got Angela as the nurse specialist, Jane that you've met, the physiotherapist. We've got Mrs Clark here, our speech therapist. She's actually got a stand today and is available to talk to you about swallowing problems. She's indeed done a speech in the past at other evenings about the swallowing difficulties in mitochondrial disease. And then behind that there's another huge team that you don't actually see. And without them we couldn't fulfil the research. They're the scientists in the lab, and it's great to see that they're actually here today. They've got a lab table at the back. They're there to answer some questions. If you've got any, have a look at the types of things that they do. And without them, and then obviously the secretaries and the administrators to help us with all the paperwork as well, we wouldn't be able to carry out the research that we do. So hopefully you'll be able to meet people in the break today as well. So what research have we done in the mitochondrial service? Well, I'm sure that some people have been involved with some of the things. And one of the things we did quite a while ago was a study into pregnancy and the complications of pregnancy. And we're actually going to take that a step further. I'm going to talk about that in a little while. But we looked at what complications were common with mitochondrial disease, such as high blood pressure and diabetes. From that, why did we do that? At the time we wanted to look at improving antenatal care for our patients. The incidence of depression and anxiety was something that was recognised in the clinics as probably quite prevalent. So there was a study undertaken to look at how prevalent that was. And the reason for doing that is that now we do a much more detailed assessment. We refer on to others for support, and we've got better treatment plans for that. This slide always makes me smile, and this is to do with quality of life. We're all here to make your quality of life better, and that's the purpose of our research. And what we want to do is determine the best treatment plans, and we can only do that if we get that information from you, because it's you that tells us what affects your quality of life, how the disease affects your quality of life, and what we need to be looking at to improve that. Fatigue, there's a little sleepy dog there. Fatigue is a major factor in mitochondrial disease, and we've got to look at ways of combating the fatigue. And we've currently got a drug trial going on at the moment that will hopefully help with fatigue. And the armband study, as Jane already mentioned, lots of people have already been involved with that, and that's helped us to look at what the levels of activity and the benefits of activity, so that we can encourage you with the activity and guide you in what you should be doing. Then you can enjoy a healthier lifestyle. So it's really important that we encourage you to take part in the research studies, because we want to change the way we give our care, and we want to do that based on what you tell us. So we've got a cohort study going on at the moment, which is a joint project between Newcastle University and University College of London. It's called the cohort study, and some of you may have been approached in clinic to join the study. What it is a database of information, and we've already got a lot of information about you from our medical notes, but we want to keep a database of information, so we ask for your consent to join that. The reason we do that is so that we can monitor the progression of the disease. We can only do that if we've got your information. And it allows us to inform you when we've got clinical trials that are appropriate for you. If we've got your information, your data there, we can let you know when we've got trials becoming available and ask you if you're interested in participating. And as I've said before, it's all for improving the standards of care. The aim is that we'll get 1,500 patients across the UK by February of 2012. We've actually got whether I make this work or not. Yeah, we've got 250 in Newcastle now, and we've probably got 100 from the London area. But we want to be, that's where we are now, and we want to be here by February 2012.